Okay, so this is Brack. He has volunteered to be my patient today. This is part 1 of the neuro assessment. We are doing the cranial nerve test. We're going to start with the cranial nerve 1, the olfactory nerve. And I'm going to ask you to push one of your nostrils shut. Just put your finger included in nostril. There you go. And we're going to have you close your eyes, okay? And then I'm going to rub something underneath your nose, and you're going to tell me what it smells like, okay?
Okay.
Ready?
Lemon.
Okay. All right, and then switch sides.
Lemon. Lemon.
Okay. It's supposed to be an orange, but that's okay. All
It's
right.
supposed to be an orange.
Let's see. We're going to go on to cranial nerve number 2, the optic nerve. We're going to assess your distance with your vision. So if you can take your glasses off.
I look better with them on, of course.
Okay. Anyway, we have our Snellen eye chart there, and if you could read, cover your one eye.
Okay, which one you want me to read?
Just the one that's...
The red?
Yeah.
C-O-C-K.
Okay. So, all right, and if you switch eyes, hold your index card and read the orange one.
B-U-T-T-E-R-F-L-Y.
Okay. All right, and then we are going to do the Rosenbaum charts, which is you're going to hold this about 14 inches away from your face, and you're going to read the very bottom. You got to take your glasses off. Yep. Read the very bottom line.
Just say the word or read the letters.
Just read the letters. It's fine.
C-L-A-S-S-R-O-O-M.
Okay. All right, and then let's see. And can you put you can read it with your glasses off. Then we'd have you put your glasses on, and then we'd have you read it again. All right, and then we're going to do your confrontation test.
Now I can't read it.
And then we're going to do your confrontation test. Okay. We're going to have you block your line of vision here. Okay. You're going to hold your card up. Block your line of vision here. Okay. Oh, this way. Perfect.
On my peripheral.
Yeah. And then you're going to tell me whenever you see my fingers kind of wiggle in.
Okay.
Okay. You look straight ahead.
Oh, straight ahead. Okay.
Yeah.
Okay, I see it.
Okay.
I still see it.
Okay. All right, that's good. Okay. So we did your confrontation test. Checked your cranial nerve number 2, your optic nerve. All right, then we're going to move on to cranial nerve number 3, which is oculomotor, 4, which is the trochlear, and then the abducens is number 6. And we are going to inspect your eyelids for any type of drooping for this on a pen light. And let's see, you take your glasses off or just put them on your head for just a minute. I'll look straight ahead. Okay. And Brack has a little bit of drooping on his right side. He does have Graves' disease, and you have macular degeneration, right? Okay. So,
you want me to look straight ahead or what?
okay, just close your eyes for just a second. I want to check your pupil response. Okay. Okay. All right. So his pupils are equal and reactive to light and accommodation on both sides, and his pupils are about a 4. So. You got to do your field visions test here. You just follow my finger, okay?
Okay, you want straight ahead or what?
Well, just follow my finger. Ready?
Yes. Can't see it.
Okay. You can move your eyes to follow.
Oh, okay.
Okay. Very good. All All right.
Yeah, I have very good peripheral vision.
Okay. All right. He was able to do that without any jerky motions, nystagmus, and everything was well coordinated. Next, we're going to move on to cranial nerve. The next cranial nerve, which is the trigeminal nerve, number 5. Let's see, we're going to palpate your facial muscles. Okay? I need you to like clench your jaws like you're biting down. Okay? And then, let's see, notice that his facial muscles and expressions are, they're symmetrical, they move appropriately. There's no atrophy, tremors, or fasciculations. I'm going to just palpate your jaw here. All right, good job. Okay, and then we're going to do the sensation test. We're going to check take the paper clip, and you're going to tell me if, well, I'm going to use this. I'm going to use a pencil. Just have you close your eyes, okay? And you're going to tell me if it's sharp or dull, okay? And you tell me, all right?
Yes. Sharp. Dull. Sharp. Dull.
Okay. Close your eyes.
Dull. Sharp. Dull.
Okay. All right. And then next we're going to do your cotton wisp test, okay? And then you're going to tell me when you feel it and where you feel it, okay?
Eyes closed.
Okay, eyes closed, yes.
Okay.
Where do you feel it?
On my jaw, left. Okay. By my eye, right.
Okay. All right, that's good enough. Okay. And then I'm going to check your corneal reflex. We're going to have you look up and away. I'm just going to take a Q-tip and tap in the corner of your eye. Okay. And then tap the side of your eye. Okay. And his reflexes are intact. Both eyes did blink symmetrically. Next, we're going to move on to the cranial nerve. Let's see, number 7, which is the facial nerve. And we're also going to check cranial nerve number 9, which is the glossopharyngeal nerve. Okay, we're going to have you raise your eyebrows. Okay, kind of wrinkle your forehead a little bit. All right, have you smile without showing your teeth. Puff out your cheeks. Okay. And then clench your lips, and you can clench your lips and blow like you're gonna whistle. Okay. All right, and then smile and show your teeth.
Better not.
Shows how pretty you are. All right. And then squeeze your eyelids shut, real tight. Okay. And then, all right, you're good. So he was able to do that with all movements being symmetric and no ticks are drooping. All right, next we're going to assess your taste. All right.
Yeah, you already used that one.
Yeah, okay. I'm not going to use it again. Anyway. All right, just close your eyes.
Closed.
Stick your tongue out. Stick your tongue out. And tell me what taste you, and put your tongue back in your mouth. What taste was that?
None.
Yeah. Stick your tongue out. Tell me it's bitter, sweet, salty.
Sweet.
Okay. All right. All right, so we assessed his taste buds. Let's see. He was able to retract his tongue and had no trouble with that, and he was able to identify the taste. Let's see, and then if you were going to have multiple flavors, then you would give him a drink between each solution. Let's see, we're going to move on to acoustic nerve, and we're moving on to cranial nerve number 8. All Alright, and for this, I'm going to have you put your finger in your ear and kind of wiggle it, okay? And spin your chair around. Okay? And you're going to tell me what I'm saying to you.
Cat.
Okay, you can do it on the other side. Do the same thing.
Dog.
Okay. Alright, and so that was the whisper test. Let's see, and he was able to hear approximately about 12 inches away from him. Okay. So the next thing we're going to do is going to do the Weber test, which is the tuning fork. Put a tuning fork on top of your head, okay? And you tell me when you hear the tone, and then I'm going to put it next to your ear, and you tell me when it stops, okay? I don't think I did a very good job of that. You hear it equally on both sides.
Yes.
Tell me when it stops. Stop. Stop.
Okay.
All right, and then you would repeat the same thing on the other side, and also you'd be timing it, and that was approximately about 45 seconds that he was able to hear that vibration. Let's see. Oh, and then the we did air conduction, we didn't do bone conduction. Oops. Put this on the mastoid process, and you tell me when it stops vibrating, okay? Okay. All right, and then we would time how long it would take for that to stop. Next, we're going to move on to the glossopharyngeal nerve, which is cranial nerve number 9, along with the vagus nerve, which is number 10. I don't have a tongue blade. Hold on. I'm gonna get this thing or something. Okay. So, all right, we're going to have you open your mouth. And take a pen light and look inside your mouth. Okay. I'm going to have you stick your tongue out and say, ah.
Oh.
Okay, and then I'm going to check. All right, and then, yep, check your gag reflex. You got intact gag reflex. Okay. And then the soft palate did rise symmetrically, and the uvula did move midline. We assessed the gag reflex. We assessed the gag reflex by checking the posterior wall of the pharynx. Get something to drink. Use this. And I'm just checking your swallow reflex. Just take a sip. Okay. Alright. And he was able to swallow without being choked, so he's got intact swallow reflex. And let's see. Yeah, no water passes back through your nose. That's always a great thing. He's able to, his speech also says that there's no hoarseness, no nasality, or any difficulty with his guttural sounds. And that concludes this segment, and we'll do a part 2. Thank you.